And now I invite Dr. Ahmed Hamid Brahimi, medical and acupuncture doctor from Algeria. It's a medical doctor from University of Algeria, acupuncture diploma from French School Acupuncture, founding president of Algeria Society of Acupuncture, member of the board of director of the French School of Acupuncture, founding member of World Association of Medical Acupuncturists, performed in Algeria as head of Acupuncture Medical Center and managing director of Nutritional Wellness Clinic, Medispa Harmony. Dr. Ahmed will talk about severe obesity and acupuncture. I invite Dr. Ahmed to the stage.
Ladies and gentlemen, my dear colleagues, good morning. I'm going to speak about obesity and acupuncture. But first of all, I would like to thank very much the organizers of this conference, especially Madame Amina, Dr. Becker, and the whole team of Holistic for inviting me to share with you my experience concerning the treatment of obesity. In this lecture, we are going to speak about speaking about obesity as a public health problem, its health consequences, and the problematic of its treatment. Obesity in traditional Chinese medicine differentiates the main forms of obesity. The main objective is help the physician acupuncturist to be able to treat all severe obesity. Standard treatment, trial for all severe obesity, descriptive study, results, analysis, and evaluation. As you all know, obesity has become a mass phenomenon which continues to expand rapidly. Some recent World Health Organization global estimates in 2014, more than 1.9 billion adults 18 years and older were overweight. Over 600 million of them were obese. Overall, about 13% of the world's adult population were obese in 2014. The worldwide prevalence of obesity more than doubled between 1980 and 2014. Obesity is a phenomenon that is increasingly and commonly encountered both in the Western society and the emerging countries. In the United Arab Emirates, 31.4% of population were obese in 2013. In USA, 33.3%, which means 1/3 of population. In the United Kingdom, 26.2%, that is more than a quarter of population. Over 30,000 deaths a year in England are caused by obesity alone. The prevalence of obesity among school children and adolescents in Abu Dhabi, approximately 20% obesity and 14% overweight. Furthermore, obesity is a financial burden increasingly heavy to bear. 2,000 billion economic cost of obesity in the world. So, Obesity is defined as excessive fat accumulation that may impair health. The body mass index, or BMI, is commonly used to classify overweight and obesity in adults. The BMI is defined as person's weight in kilogram divided by the square of their heads in meter. BMI greater than or equal to 30 is obesity. BMI more than or equal to 35 is severe obesity. For example, this man have severe obesity with BMI equal to 80 kilogram by meter square. Obesity has health consequences, which are cardiovascular diseases, cerebrovascular accident, high blood, in fact, diabetes, type 2 diabetes. Excess fat creates insulin resistance. Musculoskeletal disorders, especially osteoarthritis of highly disabling degenerative disease of the joints, arthrosis. Some cancer, endometrial, breast, and colon, breathing problem, dyspnea, snoring, sleep apnea, psychological and social effects. Obese are sometimes discriminated against for some jobs. Sexual disorders. The excess fat increases the estrogens and decreases the testosterone. Many obese men may suffer from impotence, risk of infertility. Excess fat determines hormonal imbalance in women and polycystic ovaries. The risk of these diseases increases with an increase in BMI. If the gain in weight increases the risk, the losing weight reduces it. Weight loss of 10% reduces the risk of mortality of 20%, the risk of diabetes of 30%, and the risk of cancers of 40%. It should be noted obesity is chronic disease. It therefore requires chronic treatment. Obesity should be treated continuously. This is an important point in the problematic of its treatment. What can we offer as treatment? Medication, disappointing and dangerous. Diet, dietary rehabilitation, which means change bad eating habit and learn to eat well. It's more interesting for the long term. Behavioral psychotherapy, useful sometimes for eating disorders. Bariatric surgery. There are indication are codified. BMI more than or equal to 40 and failure of the dietary treatment after 1 year. After 1 year, by nutritionists, of course. It should be noted, there is surgical risk during and after operation. For example, for this patient, he didn't recommend operation. He found himself surgeon to operate, but the indication was not good. Unluckily, the patient passed away 2 days after his surgical operation. Second remark about bariatric surgery. There is weight regain in 5 to 10 years. Other treatment, many TCM therapies, such as body acupuncture, air acupuncture, herbal medicine, as well as diet combined with exercise. So, obesity in traditional Chinese medicine is called fei pang. Body overweight is due to fat accumulation. Fat corresponds to mucus or phlegm. Phlegm is fat in TCM. Obesity results from different causes: spleen deficiency, excess heat in the stomach, liver stagnation, stagnation of qi and blood, young deficiency of spleen and kidney. Obesity due to spleen deficiency. The main signs are obesity with history of bad eating habits, tiredness, poor appetite, hypersomnia, pale tongue, white coating, thin pulse. Causes and mechanism of the disease. The spleen's function is processing food. When the spleen is empty, when the spleen is deficient, the food is poorly processed. Less processed food produce dampness. Dampness gives mucus that will form fat. The absence of movement, any slowing down of qi, can give an empty spleen. Sugar excess, work in a wrong down sedentary position, anxiousness, severe chronic diseases, sweet sexes, any form of overwork can lead to damaged spleen and give spleen deficiency. Treatment, it must reinforce spleen. Obesity due to excess heat in the stomach. The main signs are excessive appetite with fast hunger after a meal, thirst for cold drinks, acid or bitter taste in the mouth, bad breath, red tongue, yellow and greasy coating, slippery pulse, and fast. Causes and mechanism of the disease. The patient eats too much, food stagnates and generates heat in the stomach. Too spicy food, alcohol, fried food, high glycemic index food give heat in the stomach. When we have warmth in the stomach, the patients eats more because heat in stomach causes hunger. Patients eat more. Parallel to that, the spleen is deficient. It cannot metabolize this food. It follows production of mucus. This syndrome is seen in obese that eat a lot, but they have a deficient spleen. The logical treatment, it must harmonize spleen and stomach. Obesity due to young excess in the liver. The main signs: cyclothymic or depressive mood, irritability, fleshy body, history of hypertension, bitter mouth, insomnia, scarlet tongue, little smeared, pulse, taut, rope. Some emotions, such as humiliation, the sense of injustice, anger, can give energy circulation disturbance in the liver, resulting young excess in the liver. In this case, the liver loses its ability to promote circulation of physiological fluids. They accumulate and produce dampness. If it persists, it becomes mucus. When the liver attacks spleen, this worse, especially if the spleen is deficient. This determines liver-spleen disharmony. Obesity due to blood stasis and chest stagnation. The main signs are most often people with metabolic syndrome, poor appetite, bloating and fatigue after meals, dizziness, numbness of four members, spider veins in the legs, sometimes edema of ankles, tongue with stasis stacks and triple sublingual veins, rope pulse. Causes and mechanism of the disease. When chi flows, blood flows. When chi stagnates, blood stagnates. There is a strong link between chi and blood. Blood stagnation maintains chi stagnation. This causes mucus formation and thus fat. The treatment, logical treatment, it harmonizes chi and blood. Obesity due to young deficiency of spleen and kidneys. The main signs: obesity more severe, below the belt, lack of appetite, abdominal distension after eating, apathy, fatigue, limb weakness, aversion to activity, cold limbs, back pain, sometimes edema for the lower limbs with dysuria, loose stools, pale broad tongue with thin and white coating, deep pulse, thin wick. Causes and mechanism of the disease. Spleen and kidney govern water, help to carry and assimilate liquids to moisten the body. Kidney deficiency gives poor liquids transformation, forms accumulation of humidity, and gives mucus. Empty kidney is often associated with empty spleen. After studying the different causes of obesity, let's to see how to treat severe obesity with acupuncture. Treatment protocol to correct any imbalance. From this approach, we have selected some acupoints that have a versatile action on the different causes of obesity. Why an acupuncture protocol? The idea is to apply standardized protocol of acupuncture to treat all serious obesity and do study. Acupuncture increasingly needs standardization treatment protocol whenever possible. These standard protocols are easier to understand and implement. The results validate or not validate the treatment. What is the protocol for us? Brother 20, Pishu. It tones the spleen and eliminates humidity. Stomach 36, Tsusanli. It lowers the heat of stomach. It calms hunger. It harmonizes spleen and stomach. It harmonizes the blood and energy. Spleen 6, Sanin Chao. It nourishes yin, kidney yin. It corrects humidity. Conception vessel 6, Chihai. It stimulates the movement of energy and water. CV12, Zongguan. It eliminates heat from the stomach. It regularizes stomach and intestine, harmonizes middle burner. It tones the spleen to remove humidity. This calms stress. Liver 3, Tai Chong. It soothes the liver that has lost its ability to promote the circulation of physiological fluids. And kidney 3, Taixi, it calms the internal fire and nourishes yin. Of course, the technique is 4 sessions, 30 minutes, frequency, weekly during the first 4 to 6 weeks, then after every 2 weeks. Localized treatment of cellulite or hydrolipodystrophy requires electrical stimulation of local points. Of course, weight loss can be achieved if we implement sensible lifestyle and dietary rules. Acupuncture may improve treatment. To determine the contribution of acupuncture combined with diet in the treatment of severe obesity, we conducted a descriptive study for 10 years. This study included obese patients aged over 19 years with BMI more than or equal to 35. Among 2,444 patients presenting severe obesity, we excluded 958 cases of the investigation for lack of attendance. 1,486 cases met the inclusion criteria. The evaluation of parameters concerning weight, BMI, degree of obesity, and achieving the 10% reduction target of the initial weight. Analysis. Evolution of average weight for each month. The average weight decreased from 107 kilogram to 82.2 kilogram after 12 months. Curve of average loss each month. The average loss 4.6% first month. It reaches 26.3% in the 12th month. Evolution of average of BMI losses. The average BMI passed from 14.2 to 31.1 after 12 months. From the 4th month, the BMI is below 35 and therefore below obesity level of security. Evolution of the degree of obesity. The degree of obesity passes from 83 to 41 after 12 months. It's reduced by 50% after 11 months. Achieving the 10% reduction target of the initial weight. The loss of 10% of initial weight is now considered a realistic objective. This weight loss is beneficial for health. 3 out of 4 patients lose at least 10% of the initial weight in the 4th month. 8 to 10 patients lose 10% of the initial weight in the 5th month. All these results are more than satisfactory. Following the results, we made a comparative study with other groups, with other publications where acupuncture, where the treatment of obesity was done without acupuncture. We wanted to know if acupuncture brought more in the treatment of severe obesity. We found that patients receiving acupuncture lose weight better than patients of other groups. Yet their daily caloric intake was reduced by 20% rather than 30% for other groups. Also, the group of patients receiving acupuncture had less physical activity. Following this comparative analysis, we can conclude disorders of obesity are not necessarily due to eating too much, moving too little, but are results of a major energy imbalance. In this context, acupuncture would be well dedicated to harmonize the energies. Combined with dietary rehabilitation, acupuncture provides significant results with more comfort for the patients. Acupuncture regulates metabolism, reduces hunger, and calms stress. Our thought results, although interesting, must be validated by similar studies. I end with some pictures of my patients to better illustrate that we do in our center. Thank you. Thank you. If anyone needs the full text of this conference, can take it to Dr. Mahdi. Thank you.